everything that I shared with you in my clinical and my experience, I mean, it's already very good documented in many different ways with many different studies. Soft tissue dysfunction, a missing clue when treating malocclusions, the osteopathic movements that happens when we have activator and more soft forces that stimulates the muscles. So it is really, let's say, a current that it's getting bigger and with more evidence behind it. But obviously, we have here mini orthopedic, mini physiotherapy, mini. Can we say that we have a maxi effect with all these mini, or how we say in Portuguese, temos bocadinho de tudo ou temos bocadinho de nada? Então, obviously, I mean, for me, it's very important to see and to observe if we have the half full cup or we have the half empty cup. I mean, obviously, I'm suspicious to talk because I would be a person that would always see the glass half full. But still, multidisciplinary is a big word. So it's a big word, and I'm not saying that I don't send my patients to all those disciplines and all those specializations that I showed you before. But the truth, I mean, to want to share with you my truth in my clinical practice about the multidisciplinary, first, I really believe that it is the future. It is the future to work all together and to assess in this way. But then the reality, patients, I'm already doing such a big effort to pay the orthodontic treatment to my children. I mean, I don't know if I can go to all those places. Second, time and resources. Oh, who is going to take, how am I going to go to all those appointments? And then, obviously, there's already too much going on. I'm already treating the sister of the kid. And so there are many factors that come into this equation. Location. Obviously, it's not to go to any speech therapist. I mean, there is a specialization of myofunctional speech therapist. It's not that you can just go wherever you want. No, you need to go to that one that I already talked and they know how I work. So it's important to also share values with the ones that you are sending your patients to, because they need to understand what do you work. And at the same time, does the patient really understands the importance of what we are talking about? So, I mean, with all this and a super huge respect to all the different specialities, we are all seeing this and we are all fighting together to this zombie apocalypse that I say in a joke way, but actually it's a quite important topic that we are living in the sense that we are hyper, how do you say, hyper activated system in a brain that is not refrigerated, and mouths that are open. That's a lot of information that it's overwhelming. So we have people that are not really capable of establishing boundaries from the outside and the inner world. So this incapability of sealing the lips, as we saw already before, it has also consequences that we are raising people that are not conscious of themselves. So this is really a physiologically issue that has also a consciousness issue. After that, I mean, obviously the most important is that if the patient cannot have it all, what does he need the most? I mean, where are really the priorities of this patient? Obviously, for me, the most interesting part is to create opportunities. So everybody wants to breathe better, everybody wants to sleep better, everybody wants to chew the food better, but why? To have more energy. And to have more energy, maybe some patients will say, to have more energy, to be more productive, and if you want to be more productive, it's because you want to have more money, and if you want to have more money, it's because you want to be happier. So the main route is to have more energy to change the things that don't serve you anymore. And that is what really we are talking here about. And you have patients that come to you and they say, "Doctor, we are already doing all that, but my children is still mouth breathing. And it's still getting sick super a lot. And it's still with the tonsils super big and they want to operate. And who says this? A hyperventilating mouth breather mom that you can see that is full of stress. So the message that I want to bring here today, and this is a very quick scheme of a conference that was the Human Thought and the Cosmic Thought, a conference of Rudolf Steiner, that it presents the 12 ways of thinking. So it's the world that is here in the middle, and it explains that we could only access the truth if we are able to see one thing, one event, one situation from many different points of view. So the thing here is that the true will set you free, and there's a very old book that would already say that many long time ago, and it's interesting to see that then Dr. Alessandro D'Angelo, one of the professors of the Dentosophy course, puts an activator here in the middle, but it can also be dentistry here in the middle. And the truth about nowadays is that we want all the answers and to solve all the problems, only taking care of the down part of this clock. That is, idealism and the realism of our practical clinic, then the rationalism, let's say operative sequences, mathematicism, materialism, sensism. So all these things, the perception and the shape, we are really comfort and used to be in this part of the clock. But the thing is that we are really living a reality and a society that we live in compression. So this is the main, let's say, the overbite, the super occlusion. I mean, this is the good representation of the way we see the world and the way we feel the world. So in this tightness, in this upper jaw that completely blocks the movement of the jaw and enables you to move. The only bone of our head that should move freely, it's absolutely trapped with let's say, the forces of the mental and the stress. So everybody says it, everybody lives it, but who really sees it? Who really sees this situation? How can we really address it? So Dentosophy, I mean, it comes in a way and in a moment where we are doing all these questions. There is not enough space because the function is not correct. But why the function is not correct? So this type of appliances of the functional way, they actually are bringing a little bit of frustration in the clinical practices because, you are trying to change function, but if you don't address the full clock, that will not be a reality that we can support you in the change of consciousness that needs to arise with the change of function. So this is a pretty important one, and we will have to come back in the 80s. That was when the Dentosophy was born. Was born with the combination of the structure with this our beautiful Dr. Planash, and it has a very quick definition that is the use of bioactivators based on anthroposophical medicine. Okay, I will go then to there, and it has cranial osteopathy principles applied to dentistry. It's a postural integrative orthopedics and a non-invasive biodynamic for all ages. And through exercises, it helps patients to have deep changes in themselves. So, I mean, this is important, and I'm here, as I told you, not to talk about activators, the therapeutic tool. I'm here to really talk about the therapeutic method. It's not what you use, it's how you use it. So this, I mean, it's true that the Dentosophy, the name itself, I also had a little bit of resistance in the beginning, in the sense, it's too philosophical, too holistic. But the truth is that people know this and go after you and search for you for its name, because there is the book, and the book explains, and people talk, and the mouth-to-mouth is very fast, and people are ready to get, responsibility. Yeah, the clock. So with this said, it is important to address, I'm really finishing, to address the full clock and not be scared as a dentist, because we are health professionals and we don't have to say, emotions, and then we already almost drop off the stage. No, no, no. We need to address the upper part of the clock, and we'll need to be able to use spirituality. There's lots of studies that says that when people believe in something huge, something bigger, that it's not that it's far away and will punish you, but it's inside of you. It creates and enhances the possibility for you to heal. So at the same time, personality traits and mandibular disorders in children with bruxism behavior, and then effects on the chewing side in the brain. So Dentosophy is the combination of all this, and the most important thing is to try to address these philosophical and medical principles of anthroposophy and morphopsychology to create awareness in the patient that the shape that we see is a result of who he is. So to change that, it is important to create and take that message, because it does have a psycho-emotional impact, and it comes with self-responsibility. So you will attract patients that are ready to take responsibility for their change. It's not that you will do the work for them. They will do it because they know they need to use it in the night, in the day, doing some exercises. So the exercises, they are quite important, because you bring, like, let's say, an awareness on the breathing pattern and all the things in the chewing and the position of the tongue that you want to change. So here, again, the psycho-emotional part of the person is imprinted in the mouth, and every transformation in the mouth has an impact in the psycho-emotional part of this person. So this is how we know, I mean, me and all the ones that are passionate about this method, but this is how we change the world and the way we see the world. So when a person decides to consciously change their growing pattern, the behavior pattern that of a lifetime that was there from always, it also decides going towards a structural change and recognize that he wants to listen and be present in their body. So at the same time, this is the most powerful self-love demonstration, and it will be the engine for the inner change that will be a mirror and a reflection on the outside. That is what you will see, that in the end will change. So obviously, finishing this, I want to bring you this beautiful picture that is, like, say, a transformation of an old picture to a more alive, to bring this message that new generations and the future is for us to be what we want our patient to be, and to bring more life and more, to do things in a more real way, and this is what they are asking us for. So for this to be possible, I mean, this is the commercial part, we are doing the course of Dentosophy next year. We already more than 10 dentists in Portugal that are working in this way, and it's super important. If you are, take notes, take pictures of the information of the course, and also if you want to hear me a little bit more next week, I will have Aya, and be prepared, the ones that they have to use their activator, the first thing you do when you arrive to the course. And next week, I will give a webinar to explain a little bit better this method and to assess all the points of the clock. Thank you so much for your attention. Beijinhos.
Ivana,
I'm sorry for my delay.
amazing the way how you look at the patients and at the